Hair loss is a very emotional problem for most people, whether or not it's a man or a woman. What happens is that when you lose your hair, you've lost part of your personality, you've lost a lot of yourself. Today, a lot of people go to their general dermatologist to learn about hair loss or treatments, non-surgical treatments. And unfortunately, unless they specialize in hair loss, a lot of times you don't get the real answers that you're looking for. You really want to go to somebody who specializes in hair loss and hair restoration surgery. Hi, I'm Dr. Shelly Friedman. I'm dual board certified in dermatology and hair restoration surgery. I've been practicing hair transplantation for the last 30 plus years here in Scottsdale, Arizona. I first became interested in hair loss when I experienced hair loss at 25 years of age. And at 26, I actually underwent my first hair transplant. I've been very fortunate to be the founding president of the ABHRS, the American Board of Hair Restoration Surgery, which is the board that certifies doctors in hair restoration surgery. When you see your own scalp, when you can actually see your scalp, you've already lost 50% of all the hair that was in that area. Today we have some very interesting things that can actually stop the progression of hair loss. The one that I recognize as being the best thing is low-level laser therapy. For the last 18 years, I've been using low-level laser to try to stop the miniaturization. As hair is dying, it actually gets shorter and shorter and shorter and finer and finer and finer. And by using laser, we can actually stop that progression and in many cases actually bring the miniaturized hairs back to normal growing terminal hairs. When the laser cap first came out, it was the greatest thing we've ever had, where people can actually get the same results, if not better, with the unit we used to have in the office, where they wear a cap and they push the button to turn the cap on. 6 minutes later, the treatment is over. The compliance is now clearly close to 100%, and therefore we're getting the best results we've ever gotten. The best type of cap is based on how many diodes the cap actually has. The more diodes, the more energy. The more energy, the more chances that you're going to be able to stop your hair loss. So I've been very fortunate in being involved with the Xtrallux cap, the 316 or the 352 diode cap. Each diode puts out 5 milliwatts of power. So the more diodes you have, the more power you get, which translates to the most energy. It's the equivalent of using a 40-watt bulb or a 300-watt bulb. So the more diodes, the more lights, and laser diodes are different than LED diodes. LED diodes do not go deep enough. They don't penetrate the skin deep enough to get to the follicle. Whereas a laser diode does go deep enough, and if you have enough diodes, you're going to see the progression of your hair loss is going to stop. The best time for you to start therapy for hair loss is actually before you start noticing hair loss. How do you do that? Because how would you actually know? Well, the thing to do is to look at your family history. Androgenetic alopecia is based on heredity. It's based on the sensitivity a follicle has to the hormone that causes hair loss, which is DHT or dihydrotestosterone. The most important thing is to do something to stop your hair loss before it gets any worse.